Are we in a second wave of COVID-19? The number of new cases is surging around the globe, and governments are weighing options to face it. But can lockdowns work this time, and what will the fallout be? This is Inside Story. Hello, welcome to the program. I'm Hashem Ahelbarra. Just a few weeks ago, many governments thought they had the coronavirus under control. The number of cases was falling and the curve of infections flattening. Governments started lifting restrictions and reopening their economies. Some were even praised for their successes, and many people resumed their daily lives. But that optimism hasn't lasted. A sudden record number of infections is being reported in many countries. Some call it a resurgence, others a comeback. And scientists are debating how to identify and define what a second wave is. The World Health Organization says the virus is unfolding in one big wave with no evidence it is impacted by changes in seasons. And it predicts the pandemic is likely to go on for a long time. Specialists from mainland China have traveled to Hong Kong to help contain a resurgence of the virus. Hong Kong initially kept its infections down, but is now being hit by what's being called a third wave of infections. Vietnam has recorded its first virus-related fatalities. The nation was free of locally transmitted infections for 3 months, but an outbreak was reported in the resort of Da Nang last week, and there are fears it could spread. And COVID-19 cases are hitting records nationwide in Japan. Infections in the capital have spread to other urban areas. Spain is driving fears of a resurgence in Europe. Health officials warn the country could already be experiencing a second wave of coronavirus. Catalonia has closed its nightlife for 2 weeks. France, Norway and the UK have imposed restrictions on people travelling to and from Spain. France, Germany, Belgium and Luxembourg have all reported steep increases in cases. In Australia, authorities in Victoria have declared a state of disaster after a rise in infections. A nighttime curfew is being introduced and travel, shopping and recreation restricted. In the Middle East, Israel had once declared it had the virus under control. It's now averaging more than 1,700 new infections per day and ranks 5th in the world on a per capita basis, just behind the United States. Lebanon reimposed severe COVID-19 restrictions for 2 weeks after the number of cases rose. And some restrictions were re-established in Morocco as it recorded a resurgence. Let's bring in our guests. In Charlotte, North Carolina, we have Marcus Plesher. He's the Chief Medical Officer of the Association of State and Territorial Health Officials, which represents health agencies across the United States. In Hong Kong, we have Arisina Ma. She is the president of the Hong Kong Public Doctors Association. And in Rabat, Morocco, we have Azzeddine Ibrahimi. He's director of the Medical Biotechnology Laboratory at the University Mohammed V. Welcome to you all. Marcus, Florida, Texas, Arizona becoming epicenters. Midwest is also hit once again. Are we talking about mass gatherings to blame or wrong policies or a combination of both?
I think it's a combination of things. Clearly, some of these states were states that were experimenting with shutting down and reopening, and perhaps reopened a little bit early before they had taken the precautions and put various components of a response into place. We also think that there's just been some challenges around the public gradually coming to accept some of the interventions we have, like wearing masks and also participating in contact tracing. And then I think there's just been a general impatience, which we're seeing across the world. You have these shutdowns, and then, you know, people, when it's time to reopen, people are impatient to get back and try to return to their normal lives. And I'm afraid right now returning to normal may not occur for quite some time.
Arisina, how do you move from being a model that was praised by the medical community for containing the outbreak into a system that could easily collapse now with the record high number of new infections? What went wrong in Hong Kong?
I think in Hong Kong, we do have a very quiet period in May and in June. We have more than 20 days of zero local infections, and everyone thinks that we are going to get rid of that disease, especially the government. In fact, the government had taken a very loose, or maybe I would like to say a careless approach. They opened up our border, let people like sailor, cabin crew, or officials or merchants from mainland get into Hong Kong without any testing, without any quarantine period. And then they brought the index cases of our third wave to Hong Kong in the end of June. And then also our citizen in Hong Kong has also loosened their infection control. They have many social gatherings. Someone start not wearing their mask during banquets and so on. And that's why they have a large outbreak in Hong Kong. And very unluckily, this time we also involve elderly in the community as well as in the elderly home. So we are just like copying what's happened in the Western country in March and April with large scale of community outbreak, a large scale of quite many of people infected without identifiable source, and high mortality among elderly groups.
And this brings me to Morocco now, where we can see some similar patterns over there. And this is going to be my question to Azzeddine. Azzeddine, Morocco has taken drastic measures in the past to contain the outbreak. And then it decided to ease restrictions, only to shut down major cities recently because of a spike in infections. What is happening there?
Well, I think, Hashem, the trend is the same in Morocco like other countries. Actually, we have two phases. The first one was actually with the lockdown that went actually very well, actually. We had a really very low number of infection, and we have severe cases, very low number of severe cases, and the death rate was really very low. And after that, I think the economic and social pressure got, and I think maybe like the other countries, the US and Hong Kong, we loosen up. We did loosen up a little bit, and what happened? People went out to work and forgot about lots of gestures that were obligatory and were very important to have. And I think what's happened, we have an increase in number of infected people. And of course, like other countries, the Western countries, when you get the number, an increase in number for the infected people, definitely you will get some severe cases and the mortality rate will increase. That's what's happened. And actually, Morocco got to the point where we have a partial lockdown, where we have some cities we had to do it. So I think we have two phases, and we are the same trend that we are seeing in other countries. We are seeing it in Morocco.
Let's get into the debate, which is now dividing the medical community. Basically, is this a resurgence? Are we into a second wave or into a new uncharted territory? Marcus, do you see this as an indication that we are moving slowly towards the much anticipated, talked about second wave?
Well, I'm not sure if it's a second wave or just that we never completed the first wave. I mean, I think what's important is we're seeing huge increases in cases again. You know, the disease is not being very well controlled in many of the states in the United States. And so that's where we are. I mean, I don't think we ever really finished the first wave that we were in. And that's part of the reason why it's come back so strongly in these states. But I'm not sure that it matters a great deal. I mean, the fact is we are where we are, and we need to start looking at ways that we can turn this back around and get it under control.
Because when we talk about second wave or the third wave, that would give you some indications about how to move forward and whether countries are well prepared to tackle the case. And Arisina, Hong Kong is a particular case. Now it's been hit by the third wave, and some people blame the government for those decisions made in the past, particularly when it comes to the quarantine exemptions. and also the relaxed rules when it comes to social distancing. And they say those were the main reasons why the country has been hit again and again.
I think when we look at the mistake we made in Hong Kong, there is another good example we can take and to prove that is Taiwan. Similar, I think Hong Kong and Taiwan is similar. We are relative small place and different from America. There's a large place. People keep moving around inside the country. We are a relative small place. And actually, if we close the border well, we control the people getting in well, we have good quarantine procedures. Actually, when the country had cleared up the disease or cleared up the local infection, we can gradually loosen the activities or the social activity or economic activity inside that place, but keep on the quarantine procedures, keep on the border control. That's what Taiwan is doing, and they keep on doing it quite well. However, in Hong Kong, our government just maybe because of the political pressure or also with the economic pressure, they just try to loosen the border too quick, too easily. And actually, they ignored our expert opinion, ignored our advice of keep the quarantine and ask people to do the testing. Actually, our expert has approved that in our new wave of disease, actually the genetic makeup of our local citizen, the viral genetic makeup is similar to those imported cases. So this is a strong evidence. So I think in a country like us, this is such a small place. If you can clear up the disease in your country, no community case, and you want to loosen a bit, but you must do it in your country first, but keep a good border control.
Perfect. I see your point. Dean, countries with an advanced healthcare system would go for contact tracing and testing. And with that capacity, they have managed to contain the crisis. Other countries like Morocco opted for a different scenario, which is the lockdown. Now, my question is, when you see this new pattern and the new resurgence, do you think that the lockdown and the drastic measures can still be efficient in the near future?
Well, before that, I come to what said Marcus, and I think it's true, because I think when we talk about the second wave, we're making a historical reference to something that happened a century ago, where we had the second wave actually for the Spanish flu. And the Spanish flu actually is true. When it came back, it hit really very hard, and we had more than 50 million people died at that time. So it was really a reference to this kind of second wave. But I think, and I agree with Marcus, we are still in the first big wave that is here. And what we are saying, we never went back down and completely in the Western Hemisphere, I mean, in Europe and in Morocco and in Africa, we never went back and down to completely, we have 0 cases. So meaning that we are still there, and we'll get the resurgence, and we get this persistent surges of the virus. And when you are opening up and there is no lockdown, what's going to happen? This kind of situation, the number of infected people will increase. So that's something would be happening. And I think when you bring it to the human level, human dimension, it doesn't change much if you are in the first, second, or third wave, if you are infected. So that's something just to bring it to this sense of this historical kind of reference to the second wave. And I agree with you. I think for when you see countries like the US with their might, actually, and you see what's happening in New York, I think it's amazing when you get more than 50,000 ICU beds and still not able actually to confront the infection. You think about countries like Morocco and African countries, and I think the approach, there is 3 of them, and the absence of any good treatment, the absence of the vaccine, I think is the non-medical approach. It's still the best one, and I think that's the main one that we have to insist on.
I think one of the things about this whole debate, and now we get into semantics about whether this is a second wave or third wave, what's next, I think it just puts more emphasis on whether we are ready for what comes next. And Marcus, now, if you look at all the predictions that were made, all the modeling in the past, it was an indication, it was a lesson for us that we have to learn by the day. But now when you look at the pattern, we're talking about 3 different scenarios. The first one It peaks, it plateaus, it comes down. Second scenario is it peaks like it did in 1918, and that's where it turns aggressive, and that's where you have a huge number of mortality. A third scenario is basically what people are aiming for is a pattern that ebbs and flows in a controlled manner, and even if there's no vaccine in 2, 3, 4, 5 years from now, we're still in the safe side. Are you tilting towards that third scenario, or do you think we have to brace for a nightmare scenario in the future also?
No, I think that the third scenario, we often refer to that as a slow burn. I don't know if that's the best metaphor, but you know, the idea is that it's an infectious disease. It's always there. It's going to ebb and flow, but you start to put the mitigation interventions in place so that you can control it, and you can strengthen some of those things when you need to in certain areas. Hopefully you get to a place where you're only seeing the outbreaks in specific places, which we refer to as hotspots. It's a little easier to go in there and tamp the infection down. The problem is when you get infection flaring up across whole communities, it gets more challenging. You know, we really do try now to move away from some of the more aggressive mitigation interventions like stay-at-home orders or complete shutdowns, because we have seen that's had a very difficult effect on the economy.
It's
and
true.
We understand that people suffer when the economy goes down as well. It's not an either-or kind of situation. But the hope is we can get it to this slow burn where we can control it. I mean, our biggest fear in the United States would be that the infection rates get so high that it overwhelms the healthcare system. That would cause chaos. That would totally undermine the public's trust. We have to make sure that that does not happen.
Arsenia, is it the same sentiment in Hong Kong that it's about time to reinstall some of the shutdown measures that were imposed in the past to be able to contain the outbreak?
Yeah, in fact, in Hong Kong, we have, even during the first or second wave, or even now the third wave, we have never really locked down our city. People still keeping going on work, but we just are closing some restaurant or some stopping some large group activities, or the government plan to stop the election. But we don't have that kind of lockdown in Hong Kong. I think yes, I think lockdown or large-scale stop of activity is very difficult in countries like Asia. We get used to a very busy and active life. Maybe for some group of people, for example, the young adults with good health, maybe we can tolerate a very low number of infection or transmission on and off. But in order to keep the medical system not being collapsed and keep running, we must protect those at-risk groups like the elderly and so on. So maybe I think in the future, when this wave quiet down, we resume some activities, but we must make sure that we must try our best to keep protect our elderly and at-risk group. So maybe we can resume some activities, but mainly for those actively working class. But for the elderly or some community activity, we must control it well.
Azadeen, I think this virus has exposed this growing rift between the medical community and the political community. For politicians, if worse comes to worse, we're shut down. But you know, in a place like Morocco, the informal sector is the one which has been massively impacted by the COVID-19. If you opt once again for shutdowns, it means that millions of Moroccans will have to suffer more. Do you think that the country or the establishment is ready for such difficult decision in the near future?
Well, I think what you said, Hashem, it's a real description of what's happening in Morocco. And I think what's the decision makers and takers are struggling with this decision, actually. You have, in one part, the medical and the health reasons, and you have on the other side, the social and the economic pressure. And I think we need to have a balance between the two. And I think that's what we are struggling with. And I think the solution will be something in between. Is what everybody's doing. We try to do it in Morocco, basically test, trace, and track. And every time we need a lockdown, a partial one, we need to do it. And I think that's something will be happening in Morocco. And you already see it when you have any problem somewhere. We try actually to confine people and to to put them actually in isolation. But I agree with you. In countries like Morocco, I think when you have lots of informal kind of economy, that will be a struggle. And I think the balance will be there to make and the decision to take. The other thing that is a difference between Hong Kong and other Asian countries, it's the cultural that you have and the practices that you have, everyday practices. Because, you know, in countries like in Morocco, you hug, you contact, it's the mitigation is something that is not in our culture, actually. And the mitigation meaning people that we have gesture that will allow them to be in contact, to be friendly kind of. And I think this change of culture and practices is another struggle that we'll have to go through.
Marcus, this is not only shaping our lives, but it could shape our future. It could shape democracy the way we know it and understand it. It could disrupt elections in the near future. One of those cases is the United States of America. And I think as this debate keeps moving on, what would be the next step forward? I mean, to try to see how we can move forward.
Well, I think we have a lot of the tools that we need to begin to get the infection under control. I mean, first of all, people have to understand, as we spoke about earlier, it's not going to go away until there's a vaccine or a really effective treatment, or until a significant amount of time goes by and everybody's had it. So in the interim, we have to use the interventions that we have, wearing masks, doing social distancing, doing contact tracing, isolation, and then protecting people at particularly high risk in congregate settings like nursing homes and correctional facilities. Those that we can bring about this slow burn we talked about earlier if we do those things, and we can make it for a significant amount of time if we need to do those things. The hope is that we have a vaccine that comes soon that'll allow us to move more quickly to where everybody's protected. The other hope that we don't talk about as much is that there may be some more treatments that come out so that we're able to treat the vaccine. Keep in mind that it's only a small percent of people who become severely ill, and so a treatment would really be able to help to deal with that particular situation, which is so troublesome and which is the cause of the mortality statistics that we see.
Unfortunately, I'm left with only 2 minutes. Arsenia, in less than a minute, if you don't mind, against the backdrop of the pro-democracy environment now in Hong Kong and the need for people to take to the streets to express their political views, isn't this widely seen as a major risk that could further increase the risk of infections in the near future?
Actually, Hong Kong is in a very difficult situation. We are getting pressure or influence from, first of all, from different countries or mainly from the mainland, and also the policy and so on. But yes, and I with the political instability, one of the government who want to control everything would like to take the chance of the infection and the outbreak to try to limit our rights of life and also the political rights. But I think as what we see, actually this disease we can't get rid of. Even when the vaccines come out, you will see that their production or distribution will not be stable, and it will not be available for everyone in this world globally in a year's time. So we just need to find out what we can carry on and what we should stop. So I think, yes, election, life, we should carry on, but social activities, we should try to stop some of it. But most importantly, we actually found out the best way is wearing masks and personal hygiene.
I see your point. Azadine, if you were to make a decision in Morocco about how to tackle COVID-19 in the near future, what would be your top priority? Investing more in the medical sector, or for the time being, educating people on the need to respect social distancing and wearing masks all the time, every day, for as long as it takes until this virus disappears?
Well, I think, Hashem, what will be interesting, and comparing to the US and Hong Kong, we are very thankful we don't have their problems and political problems, because that's a really a nightmare. But in our case, actually, I think in Morocco, we are going through a lot of changes. I think it's going to be a struggle, the changes in the mentality, in the practices, in doing things. But I think the right way to do is what we are doing right now, is actually educating people, taking mask as the only solution that we have right now. Social distancing is something very important, actually. Hygiene is very important, actually. And the other thing, I think, if I have to think about it, there is an emergence of a new elite. That will be something very interesting for Morocco.
Thank you, Azzeddine Ibrahimi, Arisina Marcus. Bless you. Thank you very much indeed for your contribution. I appreciate your time. And thank you too for watching. You can see the program again anytime by visiting our website, aljazeera.com. For further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Hashem, Ahelbarra, and the whole team here. Bye for now.